Okay, all you parents out there, listen up, because this is a really important segment. So concussions can be confusing and scary, especially for parents like us with kids in sports. So our next guest understands that from both sides. She treats concussions every day, and she's a mom of 3 active kids in hockey and in soccer.
Joining us to bust some common concussion myths and to talk recovery is Dr. Carly Mattson. She is a doctor of physical therapy with Twin Cities Orthopedics. It's nice to have you on.
So nice to be here. Thanks for having me.
Ben and I said collectively between the two of us, we're keeping Twin Cities Orthopedic up and running with our children and all the visits.
I know, you're not alone. You're not alone.
I know, even if it's just for checking it out.
Yep.
Okay, that looks a little swollen, it's a little tender. Let's just get a quick scan just to double check, make sure everything's okay.
A little peace of mind goes a long way.
Let's talk concussions. When you talk concussion, tell me what is a concussion? Can we start with that?
Sure. So concussion is a mild traumatic brain injury, but the interesting part is it is a functional injury. So it's one that doesn't show up on a scan. So in terms of, kind of how we assess that, think of it like the brain's Wi-Fi that's slowing down. So nothing is broken, but things just aren't operating normally.
Yeah, so that is kind of like, we have a whole bunch of myths that we want to attack here, because there's a lot of them. I mean, the science has changed so much, and that you kind of touched on that. So myth number 1 is, if the scan is normal, you're fine, and you're saying like, no, because it doesn't really show up.
Unfortunately, it doesn't, and I think that's the misnomer. I think that's the challenging piece, and so it's really important to get information, and get checked out. And so in terms of the functional piece, it's really how the brain is working, and so it's not necessarily what shows up on a scan or what it looks like.
Yeah. All right, so myth number 2, this is interesting because I think a lot of people are watching clips of, I don't know, boxers, UFC, even in the NFL it happens. If you black out or know, if you'd black out or know right away if it's a concussion. So they automatically think it's the extreme version of blacking out that equals concussion, but it's not always the case, certainly not the case.
That's exactly it. So in fact, less than 5% of concussions involve a loss of consciousness. So sometimes we don't know that we have a concussion. Yeah. In fact, it can take several hours or even several days to develop symptoms. So if you've had a hit to your head or your body and you're noticing symptoms like headache, dizziness, confusion, irritability, sleep changes, you should be thinking this might be a concussion.
And I think people think concussions happen in like really heavy, hard contact sports like boxing or football or hockey, but you can get a concussion in something that isn't like a super solid direct hit.
All the time, all the time. We see synchronized swimmers, we see, tennis, we see all sorts of things like that. So you're absolutely right.
So it's important to look at those other things like the sleep and the patterns and what is normal for your child.
Exactly. Yep.
Not just the contact sports. I think swimming is a big one. I know a lot of kids hit their head on the side of the pool.
Yep.
Myth number 3. This is all about recovery, and this is really fascinating because so much has changed from when we were kids. Rest in the dark room until it goes away.
Okay, this is my favorite. So this is the most outdated recommendation. So we still want about 24 to 48 hours of relative rest, but what we've learned is that too much rest can actually slow recovery. So in this instance, movement is medicine. We want to encourage things like short walks, light return to daily activities, just a gradual introduction or reintroduction to school and work, because those things actually help the brain recover.
So we're talking about, just like, you need to flush some of your sore muscles after a workout, the same thing can be said for your head. I'm sure that spinal fluid needs to get in there and sort of get things moving so it's not so stagnant. So,
exactly.
And I'm guessing that probably don't exert yourself if you're experiencing some sort of symptoms while you're walking, probably take it easier.
Yep, kind of sub-symptom threshold. So let symptoms be your guide in that. We want to, try things. We don't want to hide from symptoms, but we don't want to push through everything either.
Yeah. Okay, myth number 4. There's a standard timeline for concussion recovery.
So another one of my favorite questions. So concussion recovery is so variable, and we get this question all the time. The cool part is now we know there are certain conditions that can affect that. So we know that there are people who are more likely to have symptoms and to have those symptoms last longer. Factors that can influence this are age, gender, history of anxiety or ADHD, migraine headaches, history of motion sensitivity, and so on. The good part, though, is that we don't see these as limitations. For us, they're clues. They help us understand what's going on with the patient so we can treat them more effectively.
Yeah. When you mention gender, how does it affect men and women differently?
That's a great question. So females tend to take longer. And I like to say it's because the female brain is so profound and intricate and, no. I'm teasing. But really what we're learning is that it's the way that our brain metabolizes sugar, essentially. So the mitochondrial metabolism. I won't get too into details, but it's really neat. Yeah. And that's what we know now, but I think in 5 to 10 years, we're going to know so much more about what, influences recovery and time frame and stuff like that.
All right, last one we have for you. You just have to live with the symptoms.
No, of course not. That's why I'm here.
Not.
That's why I'm here. So, and truly, concussions are one of the most treatable injuries that we see. With the right care, recovery is so much more straightforward than people expect. The cool part is there is so much that we can do to help our patients now. And I think one of the big things to remember is it's never too early, but it's definitely never too late to get treatment for this injury.
And one size fits all doesn't really apply to this.
Exactly,
really
exactly. Yes, and that specialist care can go so far.
Yeah, and I will even say as a parent, when you're having those conversations with your kids after a game, really think about how they're answering some of those questions.
Exactly, yes.
All right, thanks so much. So Twin Cities Orthopedics has the largest network of rehab specialists in the metro, delivering advanced orthopedic care for any need. TCO's Concussion Specialty Clinic in Eden Prairie pairs experts with technology to deliver comprehensive care for faster recovery. If you'd like to learn more, just head to twincitieslive.com and we post a link right there. We'll be right back.